Hello everybody, Dr. Shadi Ireifej here. Thanks for joining this video. If you clicked on it, it means you want to learn about diarrhea. It's gross, but very common, very, very common. In fact, we get calls all the time, day or night, about diarrhea. And it is something that is very common. It is also gross. Most pets, unfortunately, if they have diarrhea, they're not going to be able to control it, and so they're going to go in your house, which is why we tend to get a lot of calls about this, because nobody wants to live with a pet that has diarrhea, and at the same time, you want to figure out what's wrong with your dog or cat. And so let's talk about how we veterinarians think about diarrhea in our dogs and cats. We try to divide it in terms of anatomic locations. So of course, diarrhea is going to come from the gastrointestinal tract, right? And so we want to focus on the intestinal part of that word. And so the intestines themselves, and many of you may know this, is divided into small and large intestines. Small bowel, large bowel. And the diarrhea that occurs is going to probably come from one of those two areas. Could come from both as well. The small intestines or small bowel includes everything from where the stomach ends to where the large intestines begin. So we're talking about duodenum. Then after that, the jejunum. After that, we've got the ileum. And then the cecum is pretty much the junction. Sometimes the ileocecocolic junction, which is the junction of the ileum and cecum, is kind of the gatekeeper from the small intestine to the large intestine. And in the large intestine, cecum, we've got the colon and we've got rectum. And the colon is divided into ascending, transverse, and descending colon. The point is, broadly speaking, not that you have to memorize all these terms, but that diarrhea is divided into small bowel and large bowel, and that's how anatomically we separate them. Now, how can we tell where it's coming from? The bowels are inside the pet, so how would you know just from looking at diarrhea? Well, there's some pretty consistent signs. Most commonly is that with large bowel diarrhea, you have kind of almost like a mucus type feel to it. It's usually yellow discolored, although it could be any colored, but it's got that really mucusy look to it. Whereas your small bowel diarrhea tends to look like your kind of what you think of most commonly as diarrhea, kind of like that dark, wet. It could be anything from like watery all the way to kind of like pudding. And a lot of times if you see watery diarrhea, that may even push you towards large bowel category as opposed to small bowel. And so it's an important distinction because there are certain diseases in dogs and cats that affect only the small bowel, and there are some that only affect the large bowel. There are also some that can affect everything, both small and large bowel. And so some of the clues as to where to look is based on the characterization of diarrhea. So frequently we'll have pet owners either bring in their stool samples because they're assuming we're going to test the stool, which we are, or they'll at least have a description or a picture of it on their phone or something, and we can look at it and at least try and guess. Now, obviously, just like I just mentioned, it is a guess. We're going based on what we know from many, many textbooks, many research papers as far as what diarrhea looks like, but our job is to try and differentiate. However, when you're talking about academic interpretation of diarrhea, which is what I just went through, versus actual clinical applications, it may not matter as much in terms of the clinical aspects because a lot of the tests that we do are going to be simultaneously looking for the location of diarrhea simultaneously anyway. It doesn't really matter. We're going to be doing our blood work, we're going to do our x-rays, probably an abdominal ultrasound or a sonogram, maybe even a CAT scan. We're going to test the feces, look for anything abnormal from there. And so we're going to do the tests regardless. But it is a good way of systemically approaching diarrhea in dogs and cats. You want to make sure you as a pet owner are well informed. So when you use a service like vettriage.com and you're trying to describe to the veterinarian that you meet with, digitally speaking, what the diarrhea is, so what's going on with it, well, they're going to ask you questions. And one of them might be, what does it look like? Is there any blood in it? A lot of times the small bowel diarrhea, if there's an ulcer somewhere, you're going to have kind of sort of dark and tarry stool. Dark and tarry diarrhea. If you've got large bowel and there's an ulcer in the large bowel, you're going to have kind of more fresh blood, right? Because the fresh blood coming from the colon or rectum hasn't had time to be digested yet, and so it's going to come out looking like fresh blood. The blood that's in the small bowel is going through the small bowel, so it's got more transit time. It's got more time to be digested, and it'll turn kind of black, and that's the normal color that blood, when you break it down, turns into. It goes from red to black. So that's just an example of how we're going to interpret it. VetTriage.com is 24/7, United States-based veterinarian. No matter where you're located in the world, you can use the service and for diarrhea and try to figure out, okay, well, how worried should I be? And that's the next step to this video is, does every single episode of diarrhea warrant an emergency visit to the hospital? No, not necessarily. It depends. The veterinarian is going to question you. They're going to get a history from you. They're going to take a look at your pet, either digitally with vettriage.com or in person if you do go to a veterinary hospital, and try to figure out how sick your pet is. Some pets require minimal supportive care, either at home or as an outpatient from the hospital. Others require intensive care and need to be hospitalized. So the veterinarian will decide in conjunction with the physical exam findings and what you tell them. VetTriage.com is a great way to start with that. It's www.vettriage, VETTRIGE.com. And yeah, check it out. Links below as well. Thank you so much for following. I hope this video helped educate you on what diarrhea should be thought of in veterinary medicine. And we'll see you in the next video. Take care.